My name's Andrew Phillips. I was diagnosed with cancer, and before I came into the hospital, the stoma nurse came to see me. She explained what they were, A, what the operation was going to entail, B, that it was the new enhanced recovery. So obviously it was a pilot scheme and they wanted to see whether I was happy with going ahead with this.
The enhanced recovery programme after surgery has changed the way that we manage patients going through colorectal surgery from diagnosis to discharge. We see the patients in the community prior to admission and we teach them about the programme. That's the important aspect, that they know what it involves.
There was a fantastic backup team working in the hospital, from the consultants and the surgeons through to the stoma nurses, the dietitians, the physiotherapists, and obviously the nurses that were looking after me on the ward. They were fantastic.
The main difference I've seen since we've implemented the Enhanced Recovery Programme is that a lot of patients now are encouraged to eat and drink within hours after their surgery. So we're finding patients are actually hungry a couple of hours after their surgery and are requesting food and drink, which is a complete difference to a couple of weeks ago, where people probably kept nil by mouth for about 3-4 days afterwards. Finding that they're a lot stronger, they're mobilising much quicker, and they're back to a normal textured diet within 2 to 3 days after their surgery.
All our patients are now pre-assessed, and I think that's a big difference from before. Before, physio only got involved in the recovery process after surgery. Now, very much from the moment the decision is made, people are talking about their physical recovery, their mobility, the physio input. So we know patients that need to have more adapted goals. So patients with mobility problems beforehand will now get adapted goals for afterwards.
The first day I was in the high dependency ward, they even had me out walking 50 metres twice that day, which I have to say I thought at the time, gosh, this seems quite a way to go. But strangely enough, once you were up and walking, the more you did, the more comfortable you felt.
As a clinical nurse specialist who meets the patients initially at diagnosis in clinic and then following them through the whole journey, it's very rewarding to see patients actually making such a quick recovery after surgery.
When you see them on day 2 walking around, before when they're in day 2 they might have been in bed or just sitting out in a chair. It's a big difference that you see in the patients. And also just seeing their relatives come in and seeing, wow, you're up and about.
It helps reduce waste, harm and variation by improving the overall experience and getting patients fitter quicker and reducing complications following surgery, which has an impact on the length of stay and the increased capacity in the hospital.
Since the operation, it's now 6 weeks since I had it, and I'm amazed just how much I'm actually able to do now. Last week I started to drive a little bit, and it's just enjoyable to get back. I actually feel really great.
Patients are feeling a lot stronger and happier leaving hospital. We're finding that in pre-op we're giving them a lot of information about the Enhanced Recovery Programme and empowering them with their health care and their follow-up, and we're finding that patients are a lot happier with their care and are leaving the hospital with a smile.